As my colleague from Louisiana wishes we were all here voting on the deal, our colleagues on the other side of the aisle had taken yes for an answer to open up the government. I wish that's what I was on the floor here today to do. That not being accomplished, what I was hoping to be able to do is once again offer a unanimous consent request to pay the people that are working. Came down to the floor 2 weeks ago with the Shutdown Fairness Act to pay the people that we're forcing to work. Pretty common sense. Did not include furloughed workers. The other side objected. I agreed to add furloughed workers. Worked with them over the last couple of weeks. Came on the floor yesterday, offered that unanimous consent request, and there were more objections. So we offered a vote. So let's proceed to that bill. Let's work out literally clarification differences. There's really nothing substantive. We're going to pay all the workers being forced to work. We're going to pay all the furloughed workers. We added contractors. I mean, we've done just about everything we could so that we were no longer punishing the people working for our dysfunction. We're no longer going to use these individuals as pawns, and the American people as pawns in this horrific partisan gamesmanship. Unfortunately, the other side wouldn't agree to get on the bill, which, by the way, that's how you pass legislation around here. You get on a bill, it may not be perfect, there may be some objections to the other side, you open it up for amendments, you work on those differences, and then again, if the other side doesn't particularly like the bill, they can vote no at the tail end. They can block it then. But instead, they blocked it on the front end. So we immediately went into discussions. Literally about an hour ago, I thought I had a deal where at least the primary objector of the Shutdown Fairness Act was not going to object. We've hit some snags. So unfortunately, I don't think in today's session we'll be able to offer that for unanimous consent request, but I do want to tell my colleagues we are still working hard. I can do everything I can to accommodate, to clarify the bills, to let the folks on the other side know, no, we're not creating a slush fund. We're not giving the president discretion to use this money wherever he wants. We're not excluding certain workers. We're not giving the president the ability to include or exclude. We're including all the workers. So again, I will continue to, and my staff is working overtime. God bless them, doing everything they can to be able to offer this. If we don't have a deal tomorrow, at least, I'm literally hoping and praying that folks on the other side of the aisle will, at a minimum, stop using federal workers, the American public, as pawns in this partisan gamesmanship. But doesn't look like we're going to be doing that tonight. But as long as we've got some time on the floor, I guess what I'd like to do is I'd like to discuss a hearing we held earlier in the week in my permanent subcommittee on investigations. It was titled Assessing the Damage Done by Obamacare. I hate to report the folks on the other side refuse to acknowledge the very obvious damage being done across the board by Obamacare. I had three witnesses, and we kind of did this in three different categories. The first category was talking about the damage done by the consolidation of industries across the board in healthcare. If you want lower prices, I come from the private sector. What the free market guarantees is basically three things: the lowest possible price and cost, the highest quality, the highest level of customer service. Now, it's not perfect, but there's no economic system that works better than that. The problem we have in healthcare is we've largely driven free market principles out of healthcare. We have a third-party payer system. Decades ago, patients paid 80 cents on the dollar for the healthcare they received. Today, they pay about a dime. Somebody else is always picking up the tab for the specific procedure. Now, we pay dearly in taxes, in insurance premiums, but it's disconnected from the actual point of sale, from the actual cost of procedure. So there's no transparency. Doctors don't know what things cost. The provider, some accountant, and I love accountants, I'm one of them, but as some accountant in the provider's back office dealing with some accountant in the insurance and some accountant in CMS or whichever third-party payer. So we had a complete breakdown of price transparency because we don't have free market principles, we don't have consumerism, true consumerism in healthcare. But this is a chart that the senator from South Carolina put up yesterday. I think others have used it as well, that really makes the point in terms of the consolidation of the industry, which is, of course, when you have concentrated power, you have less competitive benefits. This is just the percent increase in the stock price of, I think, 7 of the top insurance carriers. United Health Group, 1,177% increase in stock price since the implementation of Obamacare. Cigna, 822%. Anthem, only 414%. Humana, 490. Molina, 859. Centene, 604. Aetna, 595% increase. This is a concentration of power, a reduction in competition, and this proves the increase in prices, the dollars, the trillions of dollars flowing into insurance companies, taxpayer dollars flowing to insurance companies because of the faulty design of Obamacare. That forced, that aided and abetted this consolidation, this lack of competition in the healthcare market. The second area of damage literally was to Medicaid. I mean, Obamacare has basically provided insurance through 2 mechanisms, Medicaid and the individual exchanges. Medicaid, of course, we talked about this in our One Big Beautiful Bill, the whole reconciliation package. The harm caused to Medicaid is profound. By allowing states to sign up able-bodied, single, working-age adults into Medicaid, that wasn't the main abuse. The main abuse is we reimbursed those states for every dollar they spent for a single able-bodied adult, they get $9 as a federal reimbursement. That compares to, for every dollar spent on a disabled child, the states get $1.33. So that has led to rampant abuse. I would call it legalized fraud. Provider taxes, provider fees. That's not health care. But the American taxpayer is picking up the tab at a ratio of 9-to-1 for those state-directed payments and, again, provider fees, provider taxes. It's also crowded out services for the disabled. There was an excellent article in the Wall Street Journal written by the father of a 17-year-old severely autistic child. And God bless this family. They're taking care of this child at home. But they could use help. And so what they were hoping for is to be able to have access to home health care. They're on a 10-year waiting list because those providers would much rather service an able-bodied Medicaid Advantage adult as opposed to that disabled child. So again, we've crowded out those disabled children from Medicaid providers, and of course we've cost American taxpayers hundreds of billions of dollars. Provider fees, provider taxes, which unfortunately we weren't able to fix. The third area of damage done by Obamacare is in the individual markets. Now, I bought health care for 30 years. Every year we'd negotiate with the insurance carriers. I remember early on when we didn't have 100 employees even, and so I'm very familiar with the small employer group markets. Probably about 3 or 4 years into my buying health care, we had, because of competition, we had an insurance carrier come in and say, you don't even need to have deductibles or out-of-pocket maximums. We're going to match your insurance rate, 0 deductibles. I thought, great. I mean, what a great year for our employees. They didn't pay a dime for anything. And the insurance rate was what we had the previous year. Well, of course, the next year, they jacked up our rates 40%, so I had to go back in the market. But that's just an anecdotal story of how competition actually worked. Now, again, I don't have the exact figures, but I do not recall, in the 30 years of buying health insurance, ending in about 2010, I don't ever recall a deductible, a per-person deductible. And generally, the way a family plan would work is you have, a number of deductibles, 2 or 3 per family. I don't recall one ever higher than $2,500, with an out-of-pocket maximum with the copays, the 20-80% copay. So a family would maybe have one person with an illness, they'd go through their $2,500 deductible, and then if their charges above that, 80-20 split, up to a maximum out-of-pocket of $5,000 per year. That's it. That's the most. Again, that started out back in the early 80s, started out maybe $100 deductible with a maximum out-of-pocket of $1,000. But again, that all, because of inflation, by the time I left, it was about $5,000 maximum out-of-pocket. What has happened because of Obamacare, the faulty design of it, forcing the small percentage of people on the individual exchanges to pick up the full cost of pre-existing conditions. Back when I was buying insurance, we had something called high-risk pools. They weren't perfect. Some modifications, we could have completely covered people with pre-existing conditions, but the way they worked is every insurer that sold products in the state had to basically take on people high risk. So as I'm buying insurance, let's say I had somebody who was diagnosed with cancer. The insurance carrier would come in, and they would do something they call laser out that individual. Not a problem, because that person right away would go into the high-risk pool, and there are so many different options in terms of deductibles, that type of thing. We could buy a plan for that individual from the high-risk pool, pretty much the exact same rates as we were getting, the exact same deductibles. If that person had a remission of cancer, no longer lasered out, he came back into our plan. It worked beautifully. It was funded by everybody. Everybody that had, employer-sponsored care, anybody that had insurance policy, a very small percentage was assessed to pay for the high-risk pool. Now, every state was different. Some states were adequately funded, some that weren't. I think Maine had an excellent high-risk pool. But Obamacare dismantled all of that and put the cost of those people with pre-existing conditions that are high risk on the backs of a single-digit percentage of the American population, causing insurance rates to skyrocket. When you hear our Democrat colleagues come to the floor and say, premiums are going to double and triple, well, first of all, that's not true. Gross premiums are going up an alarming 26% nationally, but they're not doubling and tripling. Not on employer-sponsored care, not for most people on the exchanges. What's happening is the net premium after subsidies for people over 400% of the poverty line that no longer get a subsidy, those people could be experiencing double or tripling rates. And quite honestly, from my standpoint, those are people I have a great deal of sympathy for, that I would like to do something for. But we're not going to enter a negotiation until Democrats open up the government, okay? But again, I've said this repeatedly, I am happy to work with Democrats who will work in good faith, who will acknowledge the problem and repair the damage done by Obamacare and transition to a system that actually works. I think all Republicans are eager to do that. I know President Trump just had a tweet today. What we should be doing is we should be giving the American, these hundreds of billions we spend on this, give that to the American public and let them buy insurance policies that fit their needs, not the highly restrictive ones in Obamacare that have caused premiums to skyrocket. So what this chart shows, the red line here is the increase in the CPI. In other words, total inflation since the inception of Obamacare was 39%. All these blue bars, I know it's hard to read, this is every state, the percent increase in their premiums. I mean, it's for a 40-year-old enrolled in the silver benchmark. Again, averages are very difficult here because you have every state different, all these different plans, but we've picked one. This is pretty typical. So the average percent increase by state over all the states is 169% increase versus 39% increase in inflation. That's 4.3 times the rate of inflation. This is what has been happening to the 20-some million people on the individual exchanges. It's because the faulty design of Obamacare. It's got to be fixed. We can fix it. We know how to do it. You reinstitute high-risk pools. You give consumers a choice of all kinds of different options, short-term plans, catastrophic care. By the way, Obamacare insurance is what catastrophic plans looked like in the past, only orders of magnitude more expensive. So again, this is the gory snapshot of what Obamacare has done to individual premiums. Now, I've got another chart that shows you what's happened in the marketplace for employer-sponsored plans. You don't see anything up here at the over 300% level. You see really quite consistency because Obamacare didn't impact employer-sponsored care anywhere near to the extent that it did. Now, it's still way too high. On average, employer plans increased 74% since the inception of Obamacare. A lot of this is driven because of what Obamacare has done in terms of consolidation of every part of the healthcare industry. So there's no reason for these insurance rates to be almost double the rate of inflation. But it's a huge difference. It's a huge difference because there's greater freedom in the employer-sponsored insurance plans than there is in the very prescriptive Obamacare. This last chart, I'm glad I had it because in the hearing, my ranking member, the senator from Connecticut, made the statement that I don't know anybody who's been harmed by Obamacare. Huh? What? I mean, I already mentioned the consolidation of the industry. I mentioned the disabled child who's being crowded out by an able-bodied, working-age, childless adult. I already talked about the dramatic increase in premiums for everybody. But the Democrats' own witness, a mom from Wisconsin, was a victim of Obamacare. This isn't exactly what her premiums are because she, quite honestly, didn't have all the information. But she had a few key pieces of information that we could go to look at Obamacare exchanges, come up with the premiums. But this is showing you what's actually happening, okay? This individual, a mom, 2 kids, great person, is a victim of Obamacare. In 2016, her employer dropped coverage because Obamacare gives small employers a great out of not having to put up with the rising health care costs by just saying we're not going to buy group insurance anymore. But trust me, I never liked having to buy group insurance for my employees, but you had to do it. To be competitive, you had to provide insurance. Again, I'd never want to see any of my employees go uninsured, but now you've got an option. And so a large number of particularly small employers are dropping coverage and forcing their employees into exchange. So in 2016, she got forced into exchanges. Now, she initially bought a silver plan. It cost her $1,000 a month. Again, to me, some of you had bought insurance 15 years ago, unbelievably high insurance rate. $1,000 a month? Unheard of back when I was buying insurance. So anyway, that was too expensive for her. So a couple of years later, she actually transferred to a bronze plan that she could afford. It cost her $250 a month. But it had a $14,000 deductible. Again, I said earlier, when I was buying it, out-of-pocket maximum for families was like $5,000. A $14,000 deductible, that was a catastrophic care plan. They were dirt cheap. So anyway, so they signed up for that plan. Unfortunately, they had some big health care bills. And her husband had to take out an $18,000 home line of credit. $18,000. This is the Democrat witness, a true victim of Obamacare. Now, of course, she's coming in, very sympathetically, asking us to extend the temporary enhanced subsidies. But this is what people need to understand. They obviously are under 400% of the poverty line because she's still getting subsidies. So look at the annual figures here. In 2025, with the subsidy, her gross premium, again, when the Democrats say, they're doubling premiums, they're talking about the net premium. But the gross premium was $15,000. She got a subsidy of almost $10,000. So she's paying $5,500 a year. Now, remember, in 2019, she had a silver plan. She was paying $12,000 a year. So now, with the enhanced subsidy, the temporary COVID one, again, remember, Democrats are the ones that chose it to expire. She's paying about $5,500. Fast forward, if she loses that enhanced subsidy, she still gets more. She gets a higher subsidy. She's still going to get $10,000, but because her gross premium, because of the faulty design of Obamacare, is going from $15,000 to $19,000, yeah, she's going to experience almost a $3,000 increase in her premium. But not because the enhanced subsidy went away. She's getting an increased dollar amount of subsidy. It's the dramatic increase in premiums that's driving this. And I'll close on this point because I see the senator from Florida, who, by the way, knows more about health care probably, maybe than anybody in America, certainly in this chamber, and he's got some great ideas on how to fix and repair the damage done by Obamacare and transition to a system that will actually work based on a competitive model. But the other point I want to make, because of their rhetoric, because of their demagoguery, Democrats are pretty well, I think, scared. Of course, that's their tactic, right? Let's scaremonger. Scared Americans into believing that everybody's premiums are going to double and triple. First of all, we're talking about the Obamacare exchanges, which they say they've got about 24 million people, but because of the no premium policies with these enhanced subsidies, there's probably about 6 million people with phantom plans. They don't even know they have coverage. Unscrupulous agents have signed them up. They get the commission. The premium goes right to the insurance company. They're none the wiser, and they make no claims. So we've gone from, I think, 4 million no-claim policies on the exchanges to 12 million. So obviously, there are a lot of phantom policies there. But the point I wanted to make is, out of the whatever the number is, it's really not 24 million. It's probably under 20 million, but I'll use that as a figure. Of the supposedly 24 million people on the Obamacare exchanges, almost 22 million are going to continue to get their subsidy. They're under 400% of the poverty line. You got about 1.6 that we know are over 400%. Their subsidy is going away. So if they were at 15 and going up to 19, instead of paying, they're going to have to pay $19,000. Those people I have a great deal of sympathy for. They were kind of duped into thinking that they could retire early. And now they're getting the rug pulled out from under them because the Democrats chose this plan, and now it's expiring. So I've got some ideas. I've actually shared them with our finance chair. I've shared them with Senator Scott. I'm not going to talk about them now because we need to open up the government first. But personally, I'm sympathetic with this. But we don't need to spend $20, $30 billion to address that small slice of the American population whose subsidies totally go away. The main point, and then I'll turn it over to the senator from Florida, my main point is almost 22 million Americans on the exchanges will continue to get subsidies, and because insurance rates are going, those subsidies on an annual basis are going to increase. They're not even going to decrease. The dollar amount will be increasing for most of those 22 million Americans. They're going to go back to the way Obamacare was originally designed. So if they can't afford the health care, based on going back to the way Obamacare was originally designed, it's not because the enhanced subsidy is going away. It's because of the way Obamacare was originally designed. It's failed miserably. It's damaged millions of people. And I am happy to sit down with the other side if they're willing to acknowledge the truth, admit they've got a problem, define the problem properly, do a root cause analysis, and actually enact reforms that will lower or certainly keep in check the cost of health care. With that, Mr. President, I yield the floor.